All right, so today we're talking about GBS. GBS is short for group beta streptococcus, which is a bacteria that's part of the normal flora in some men and women. In pregnancy, it can also be present in the vagina in about 1 in 5 pregnant people. Um, if this happens, it's really not a big deal to the pregnant person. It might lead to urinary tract infections, but the main concern is for the baby during a vaginal birth. If they're exposed to it and become infected with the bacteria. This can lead to something called early onset GBS disease, which occurs within the first week of life. So some risk factors for being a carrier of GBS include having frequent sex or multiple sex partners, certain hygiene practices, or being African American. There are also risk factors for babies of developing early onset GBS disease because not all babies that become colonized, like are exposed to the bacteria, end up with the infection. Babies that are more likely to get this infection include when water has been broken for a long period of time, over 18 hours, if the laboring person develops a fever in labor, or if the labor begins at less 37 weeks or earlier. And the earlier gestation at the time of birth, the more likely the baby is of developing this disease. And so there are testing options for you to see if you are positive for GBS. This includes a vaginal or rectal swab to see if the GBS growth is present. And there's really no harm of doing the testing to you other than it being a little uncomfortable, maybe embarrassing. But you do have the option to decline the testing. The downfall of this is that we'll just be extra alert if the baby, for possible GBS disease after birth, and if your water's been broken for a long period of time, or if you develop a fever, we'll be more ready to recommend a transport to the hospital. And if you are to transport to the hospital without GBS testing done, they'll recommend IV antibiotics and treat you as if you are positive, which you can decline. It's just kind of a hassle. So if you are positive, the best course of treatment is to have IV antibiotics in labor. It's recommended to have 2 doses, at least 4 hours apart, at least 4 hours before the baby's born, to greatly reduce the chance of infection. The downfall of this is that it's altering your microbiome, and so if this happens, we do recommend you to increase your probiotics and try to build up your good bacteria after the birth. You do have the option of declining antibiotics, just like anything else in your pregnancy. There are some alternatives you can consider, like garlic suppositories, a vaginal douche with a soap solution, and we can talk about these more if it comes down to it. Do you have any questions?